Hi, my name is Gabriella Napier, and today I'll be telling you a little bit more about healthcare in least developed countries and the impact of technology. So as a quick overview, I'll start with a background on what advancements specifically in technology I'll be referring to. Then I'll give a baseline of what's considered as a least developed country and the current state of healthcare in these countries. And finally, we'll be going through different applications of these new technologies through specific patient profiles. And then I'll end with discussion and questions. So a little bit of background on what are the technological breakthroughs that have brought advancements to healthcare. So the first is the rise of the Internet of Medical Things, or IoT, which includes numerous medical devices that record and monitor, which provides data to other medical devices that can be utilized for healthcare IT systems. The growth of IoT can be attributed to the accessibility to wearable devices like your smartwatch or your Fitbit and decreasing costs of sensor technology. Also, most consumer mobile devices like your iPhone are now equipped with near-field communication and radio frequency ID, RFID, tags that can communicate with other IT systems. IoT has also led to the rise of mHealth, or mobile health, which is the utilization of smartphones and tablets for communication and documentation between physicians and also from physician to patient. The second technological breakthrough is telemedicine, which allows us that virtual at-home consultation with the doctor. Although this has been around for about 3 decades, with the rise of video conferencing, increased wearable devices, and the fact that more people own a cell phone in the world than a toilet, telemedicine will continue to be at the forefront of healthcare technology. The third technological breakthrough is artificial intelligence, or AI, which is broken down into 2 main categories in relation to healthcare. The first is machine learning, which includes utilizing data from IoT to dig out clinically relevant information so your doctors can make decisions through predictive analytics. And then the second category is natural language processing, which is using voice-based assistants similar to Siri or Alexa to help prioritize work tasks in a clinical setting. And the fourth technological breakthrough is new take on classic tools. Healthcare equipment manufacturers like Siemens, Philips, and GE are continuously making updates to your classic medical tools, making ultrasounds more portable, x-rays electronic, and pulse oximeters or fetal monitors wireless. In addition to these companies, nonprofits and NGOs are finding ways to take the typical CT, MR, or oxygen equipment and making them more robust for use in harsh environments or in communities with low resources such as electricity and water. In summary, the 4 aspects of technology that have helped healthcare advancements are Internet of Medical Things, telemedicine, artificial intelligence, and a new take on classic tools. Our focus for this presentation is how these technologies have impacted least developed countries. But what exactly is a least developed country? So according to the United Nations, the least developed countries are the poorest and weakest of our world, composing of more than 800 million people, which is 12% of our world's population. This 12% actually accounts for 2% of the world's GDP and only 1% of global trading goods. These countries confront severe structural impediments to sustainable development. The UN looks at 3 criteria for considering a least developed country. The first is gross national income, which is the nation's gross domestic product plus net income from abroad. The second is economic vulnerability index, which includes indicators such as population, location, economic structure, trade, victims of natural disasters, and instability of production. The last criteria is the Human Assets Index, which includes education and health. And we'll dive into health a little bit deeper since that's our focus. HAI is made of 3 indicators. The first is under 5 mortality rate, which is the probability of dying between birth and the age of 5 per 1,000 live births. So in our example here, we're looking at Uganda. In Uganda, there are 53 deaths for every 1,000 live births. Contrast that with the United States, where the median number of under 5 mortalities was 6. The second HAI indicator is percentage of populations undernourished, which measures the amount of people whose dietary consumptions continuously falls below an established minimum dietary energy requirement. In Uganda, as you can see here, 43% of Ugandans are undernourished. And the last indicator is maternal mortality rate, which is the number of women who die from pregnancy-related causes while pregnant or within 42 days of pregnancy termination. In Uganda, for every 100,000 births, 343 mothers are dying. Contrast that with the United States, where only 14 mothers are passing away for every 100,000 births. It's pretty apparent that the LDCs need help in the healthcare sector. Uganda isn't even the worst. It scores just below average out of the 47 LDCs for HAI. It's ranked number 26 out of 47. So how has technology helped these LDCs? Let's meet some Ugandans whose healthcare has improved due to the technological advancements like Internet of Medical Things, telemedicine, AI, and a new spin on tools. First up, we have Eshe, who lives in rural southwest Uganda with HIV. The healthcare professionals that treat Eshe have taken advantage of virtual and online training offered by University of Washington's Global Health e-learning on how to clinically manage her HIV. Online trainings like this will help with the shortage of physicians. Sub-Saharan Africa carries 24% of the world's global burden of disease, and only 3% to support that with world healthcare workforce. The disparity is so large that in the past year, doctors from Cuba have been imported into Uganda. In addition, apps like Gozi make it easy for Eshe's doctors to help her find specialists when she needs a referral. When Eshe's doctors need a second opinion on skin conditions often common in HIV patients, they turn to apps like FirstDerm, a mobile app that takes photographs of a patient's skin lesions, which are then reviewed within 24 hours by a board-certified online dermatologist. Eshe's HIV management occurs through antiretroviral therapy. WisePill, an electronic pill box, is helping Eshe adhere to her life-saving therapy regimen. Before using WisePill, Eshe would self-report to her doctor during her intermittent check-ins and would often forget her medicine. Now, since WisePill uses mobile connectivity to transmit data to a central server every time Eshe opens the pill box, if Eshe forgets a dosage, a text will be sent to her mobile phone. WisePill is helping Eshe manage her HIV. Recently, with the confirmed outbreak of Ebola in neighboring Congo, Eshe's friends have been trained by the Uganda Red Cross to use a real-time mobile system to help detect any potential outbreaks in her community. The reports allow the government to keep surveillance of Ebola in the country. In addition, Eshe also knows who to contact if her family members have Ebola-like symptoms. She lets her friend know, who then sends a message to their supervisor, who alerts a local medical response to help take that person to the hospital. Overall, advancements in technology have helped communication on all levels of Eshe's healthcare and community, from the doctors to her personal health regimen and even to her community. Let's meet another Ugandan, Dembe, whose healthcare experience has been impacted by technological advancements as well. Dembe just had her first child. When she went in for her routine check-ins during her pregnancy, the doctor at the local clinic utilized GE Healthcare's V-scan, a pocket-sized ultrasound that can be used to perform basic fetal measurements and fetal positioning. Without the V-scan, Dembe would not have gotten an ultrasound, since the machine was only available at the district hospital that could afford the equipment. When Dembe's newborn contracted pneumonia, his life was saved by FREO2, a low-pressure oxygen storage system that stores medical-grade oxygen. Even in the event of a power outage, which happens in rural Uganda quite often, this system can provide oxygen to the baby for up to 8 to 10 hours during its treatment for pneumonia. The hospital that Dembe's baby was treated at is one of 600 health facilities that have implemented Uganda EMR, an electronic medical record system. Electronic medical records, also known as electronic health records, EHR, will assist Dembe's doctors in reducing medical errors, achieving better effective care coordination, and will also aid in reducing healthcare costs. Through Uganda EMR, records of the treatment for Dembe's baby are available for authorized users in other healthcare facilities. In addition, Uganda EMR can coordinate reminders to Dembe for her baby's checkups. The health professionals at the hospital also use MTrack, a mobile health initiative where they can report health service-related issues, including stockouts for essential drugs that happen in the hospital. This triggers a delivery of the medicine back to the hospital. Prior to MTrack, money and time would be needed spent driving to national medical stores just to get the stocked-out drugs. MTrack has standardized drug management and operations for health centers all across Uganda. Finally, Dembe is part of the 90% of Ugandans without health insurance. With the unexpected pneumonia treatment expense, she utilizes Clinic Pesa, an application that can be accessed through her mobile phone to pay her medical bills and purchase medicine. As a digital micro-savings and loan platform, Clinic Pesa leverages mobile money services that Dembe already uses on a daily basis and sets aside funds to offset her medical bills. Without Clinic Pesa, Dembe would not have been able to pay for the life-saving treatment her baby needed. Overall, advancements in technologies have helped equipment utilized by Dembe and her doctors in her healthcare experience. These are real tools and applications that are currently available in Uganda, and Eshe's and Dembe's experiences with the healthcare technology in Uganda isn't unique to this country. Other least developed countries, including their African neighbors, utilize similar apps or even the same medical equipment that Eshe and Dembe use. Thanks to the technological advancements like the Internet of Medical Things, telemedicine, artificial intelligence, and new takes on old tools, the future looks bright that the list of 47 LDCs will continue to shrink as their Human Asset Index scores get better. So now I'll turn it over to you. So what challenges or roadblocks do you think LDCs like Uganda face when implementing new technological advancements in the healthcare space? Do you personally have any experience with healthcare technologies, and how has your life been impacted, whether that be positively or negatively? This can include any wearables, apps, telemedicine, MyCharts, etc. And finally, who do you think should be in charge of building these new healthcare applications? Should it be the government, private companies, NGOs, nonprofits, people like you and me, all of the above, or none of the above? Why? Thanks everybody for listening, and I look forward to the discussion and feedback.